Hello, my name is Doug Kavaraki. I'm the Deputy Director of Samueli Integrative Health Programs. Our organization, Samueli Integrative Health Programs, is dedicated to the promotion of personal health and well-being with the support of health teams dedicated to all proven approaches, including conventional, complementary, and self-care. Thank you for joining us today for this webinar briefing to discuss the new findings from a recent Harris poll conducted on behalf of Samueli Integrative Health Programs on how Americans view and define health and how their conversations with their doctors match up with these views. Before we get started, I want to go through a few items of housekeeping. To avoid background noise, all attendees are automatically muted throughout the webinar. If you have any questions during today's presentation, simply type your inquiry into the questions box in your attendee control panel. We will then answer your questions at the end of the presentation. Also, just a reminder that today's webinar is being recorded. That recording, as well as slides from today's presentation, will be available to members of the media afterward upon request. If you have a question or an issue with the webinar technology, you may type your question through the Q&A section of the attendee control panel, and someone will respond to you as quickly as possible. You may also contact GoToWebinar technical support by dialing 888-259-8414. With those items out of the way, let's get started. Today's presenter is Dr. Wanye Jonas, Executive Director of Samueli Integrative Health Programs. He's a practicing family physician and clinical professor of family medicine at the Uniformed Services University and at Georgetown University School of Medicine. Previously, Dr. Jonas was the director of the NIH Office of Alternative Medicine and director of the World Health Organization Center for Traditional Medicine. He is a retired lieutenant colonel in the United States Army Medical Corps and a former director of medical research of the Medical Research Fellowship at Walter Reed Army Institute of Research. Without further ado, I now turn it over to Dr. Jonas.
Thank you, Doug, for that introduction, and welcome everybody who's attending this webinar. I hope you enjoy it and that the information that you get is meaningful for your day-to-day work. So let me get to the core issue that motivated us to do this survey, or asked Harris Poll to do this survey, and that is the question of to what extent is healthcare producing health, and if it's not, how do we actually get it there? You know, in healthcare reform, the debate rages about who pays for the current approach to medical care, and yet, no matter who pays, if it's not producing health, then it's going to continue to cost us more and lose value. The debate rages on this balance between curing and healing. We see that modern medicine, as it's currently practiced, has diminishing returns. We are first in healthcare spending among all the countries in the world, and yet, according to the WHO and other metrics, we're about 37th in our actual health outcomes and continuing to get worse in many areas. In addition, the rate of rise in healthcare is astronomical. It's estimated that close to 25% of our gross national product will be spent on healthcare at the current rate of inflation in 2025, and if it keeps going by 2082, we'll be spending half of it. All the while, the baby boomers, the aging population is putting increased demands on that, and the costs are driving disparities wider and wider. The gap between those who can pay and those who can't pay is increasing. But the reality is we are all paying for that gap, and so it is unsustainable as we move forward. We need a different way to go about delivering health care. Here's a slide that I think in a single snapshot captures the diminishing returns in value for modern health care. The U.S., which is that circled dot on the far right, spends over twice as much as any other country in the world, and yet has a life expectancy on the level of about Czechoslovakia or Poland in those areas. We're paying a lot, and yet we're not getting increased quality or quantity of life from that value. And in fact, recently, over the last 2 years, we've had a decline in life expectancy in the United States after over 80 years of steady rise in life expectancy. So something isn't working anymore. So if the value in health is not from paying for health care, where is it? And we also know this. 80% of the value of what produces health actually lies outside of the clinical encounter of what medical care delivers. Medical care produces about 20% of population health, and the rest has to do with social, economic, behavior, and lifestyle factors, the so-called determinants of health. So if we really want to produce health, we're going to have to widen our lens. And if health care delivery wants to be part of that solution, it's going to have to get out of the top black area in this graph and begin to address these underlying determinants of health that make up the bulk of health care. So this is the background behind what's led to our desire to do the survey that I'm going to show you the results of today. We wanted to know that what was happening in the bread and butter of day-to-day health care. What happens in the office between the patient and the provider, which happens literally millions of times a day as the provider, then the patient, and the doctor or the nurse practitioner or others encounter the patient. The problem is that many doctor visits address mostly physical symptoms and test results. The physician's time is limited. He or she works hard to provide the patient with most pertinent information and useful treatments. It's hard enough to keep up with medical treatment. And as important as these topics are to discuss, it's also important to look at these underlying determinants that I just showed you about. And so we wanted to find out if doctors and patients were in fact discussing these topics on a day-to-day basis. Fundamentally, we wanted to know, how do Americans define health? What do they see as health? And what do they do that influences their health? And what do they want to have out of their doctor visit to help them do that? So to do this, we commissioned the Harris poll to do a representative nationwide survey of the public, any adults 18 or over, focusing on their perceptions and definitions of health, their experiences with their primary care physicians, and how those experiences match up with their personal perceptions of health and well-being. And so we spread this out over the country. Harris Poll looked at the geographical regions, and I'll show you some of that data also as we move forward. So first, we wanted to examine how do people perceive their health and control of their own health. So we asked, how would you describe your current overall health care? We found that 76% said their health was excellent to good. This is great news. And we found that those who said their health was excellent to good, more of them feel like they have control over their health. They're less likely to actually have a chronic disease, makes sense. They're more likely to be satisfied with their conversations with their doctor, and they're more likely to have aligned their life goals, what matters to them, with their health goals, what's the matter. This perception of positive health, in addition, is an important thing because other data shows that if you perceive your health as positive, it's one of the best predictors of actual future health. And so one's mind and mental framework around health care is key to actually maintaining health. We also found geographic differences. Those in the Northeast were more likely to rate their health as excellent compared to Southerners and Midwesterners. There were some differences between the Northeast and the West, however, that were not significant. Because of the increased rates of chronic disease, we wanted to know how many people have been diagnosed with various conditions and how that diagnosis might affect their perceptions of health. We found, as many other surveys have found, that about half of individuals in this country suffer from one or more chronic disease. The most commonly reported, interestingly, are mental health conditions. 19% reported depression, 18% suffered from anxiety, and in addition, 1 in 10 people were living with chronic pain or diabetes. And we all know chronic pain and its relationship to opioids and opioid crisis right now is a key issue. And we also know that non-pharmacological approaches to chronic pain are an important recommendation now being made in guidelines in these areas. We also know that diabetes, at least type 2 diabetes, adult onset diabetes, which is the most prevalent type of diabetes, is not only growing, but it is also lifestyle based. It is a condition that, that you address primarily with behavior. And in fact, both the European and American national associations just came out with joint guidelines yesterday showing that the primary lead for the management of diabetes has to be lifestyle, and it has to be person-centered. It has to be related to linking it up to what the person wants in their own life if it's going to be properly managed. The reason this is so important is that a whole person approach, a widened lens, needs to be taken in these conditions, addressing the behavioral components, and discussing these factors with physicians then becomes key. We found that, that the vast majority of people felt like they had control over their health, that they actually could influence it in some way, even beyond the doctor. Those who felt like they had control over their health were more likely to rate their health positively, more likely to define health in broader terms, such as happiness, independence, mental health, and longevity, less likely to have a chronic illness, as you would expect, more likely to be satisfied with their conversations with doctors, and more likely to discuss certain types of behaviors, such as sleep and its relationship to health, and also more likely to have aligned their personal life goals with their health goals to motivate them through that link. So then we went on to take a look at definitions of health. This would help us provide insight into how Americans understand health of all the factors that can exclude it. So we asked the surveys how much do you agree or disagree with each of the following statements, and we found overwhelmingly that Americans agree that health is much more than simply being sick physically. In fact, 9 out of 10 either agree strongly or agree with the statement that health is more than just becoming sick. In addition, 84% agreed that they have health goals that align with their life goals, meaning that their goals are being matched up with their life goals. That is, what matters to them is aligned with what is the matter with them. In terms of how Americans define health, 3 in 4 defined health as not being sick, as you would expect, but this was not the only definition by far. Respondents were given the option to choose from a wide variety of definitions of health, and the results here show us that Americans' definition of health is very broad and accompanies many factors. In fact, 22% of respondents selected 5 of the 7 items in the definition of health. And so clearly people are using many, many definitions. Some of the top definitions included being happy and feeling calm and relaxed, both the mental and spiritual, perhaps, social and emotional factors in the definition of health. As they got older, especially living independently was very important. The ability to function properly became a key definition of health, even if they had a chronic disease. Now, the adults over 65 had a broader definition of health than those that were younger. They checked more items. Nearly 7 definitions of health were checked for those compared to those 18 to 44, which selected only 4 definitions. So the definitions shift as the age changes, but it increases broadening as we get older in terms of what we define as health. So now that we had a better understanding of what Americans define as health, we wanted to know if these factors were important in the actual primary care doctor's visit. Were these things that were discussed with their physician since they valued them most? We wondered if doctors and patients were talking about these factors. So we looked at those who had primary care physicians, which was the vast majority of those in the survey, and asked them, what do you discuss with your doctor? We found that 74% discussed physical health, as you would expect. 56% discussed test results, another aspect of mostly physical health, and 52% discussed medications, again, part of the treatment pills and procedure approach. Fortunately, over 50% talked about regular exercise, which is a behavior that we know impacts many of the chronic illnesses that are plaguing our country today. But unfortunately, fewer than half were discussing core determinants of health that we know are in the 80% of what produces health. Diet and sleep habits, for example, were discussed by only 44 and 40% during these visits. And even fewer, only 20%, talked about why it was important to be healthy. In other words, what aligns in your life goals with your health goals, what motivates you to engage in the kind of behaviors that will keep you healthy in those areas. And then most alarmingly, I would say that even though a large portion of the population suffers from a mental health condition, depression or anxiety, and they also see health as mental in many ways, such as happiness, stress management, being calm and relaxed, etc. Only about a third, a little over a third of the conversations with their doctors engaged in these psychological conditions for Americans. So we found that most people talk about their physical health, their medications, their test results, and physical activity, and then we wanted to know, did they want to have those conversations? And we found that, that indeed for many of these areas, they did want to have those conversations with their doctor, and it varied quite a bit by age. About 45% said they wished they talked about their life goals, what matters to them, and how it aligns with their health goals in those areas. And surprisingly, even more younger adults, those 18 to 24, indicated that they wanted to talk about the behavioral determinants of health with their doctors more than they did. It appears that as patients desire these conversations into the future, we need a more whole person approach to health and healing, and there's a growing awareness that those kinds of behaviors are key to not only staying healthy, but in many cases reversing chronic illnesses. So in summary, we know that we need to broaden the lens in the day-to-day conversations with physicians to the determinants of health, those things that actually produce health, and to bring that encounter and why that's important and how it links to one's own life goals, what matters to the patient, into that conversation. So that was the findings of the poll. I think it has a lot of implications in these areas, and I look forward to your questions and a discussion about the meaning and interpretation of these findings. Thank you very much.
Thank you, Dr. Jonas, for this presentation of these findings. We will now move on to the question and answer portion of the webinar. And it looks like we already have a few questions in queue. As a reminder, to ask a question, please submit your text question through the Q&A section of our attendee control panel on your screen. Our first question is for Dr. Jonas. Dr. Jonas, how should doctors begin to incorporate these conversations into the patient experience?
So I think one of the ways to do that is to simply ask these questions. The questions that go on in the encounter, if we shifted them over more to what matters to the patient, that's the alignment of the life goals and the health goals, and if we began to simply ask patients about the underlying things that we know determine health, and in fact can manage, prevent, and in many cases reverse chronic disease, then putting that into the encounter is the way to do that. Not simply asking about that. You can ask your doctor to ask those questions. In the world I work in, we call this integrative health. It's in an integrative health visit, and we have actually some guidelines on my website about how to do that. We're working closely with primary care physicians around the country to streamline that process so that it can be done in everyday practice. And so it starts with the dialogue that goes on around these things that are determinants of health and what's important for the patient in the encounter.
Thank you very much. The next question is also for Dr. Jonas. Why do you think younger people are seeking out these conversations with their doctors compared to their older counterparts?
I think younger people are much more aware that behavior, lifestyle, and underlying determinants of health, social and other factors, have a major influence on their health. The literature and the evidence is growing. Access to that information by younger people is there, so they can actually Google it and find out, what are the major factors that might be available for managing weight, mental health issues, diabetes, et cetera, or even preventing them. And so they realize that those conversations have to be had with their physician, not just simply what medications to take or what procedures to do or what tests to do. And so I think younger people are more aware of that. It also empowers the younger people. I think I find in my own practice that they're more empowered to actually take action in those areas. They'll often come in and have a list of questions for me and say, hey, I read about this or I heard about that. What do you think of it? And so they draw me into the dialogue with them as a partner. Now, interestingly enough, this kind of person-centered care has been recommended for a couple decades in this country. The landmark study, Crossing the Quality Chasm, that came out in 2001, and then an update on the global quality chasm that came out last year, all said the patient should be in the driver's seat when it comes to chronic disease, to prevention, to healthcare management in those areas. And so that kind of empowerment, I think, is beginning to penetrate the population. I think older people probably were used to just being told what to do and I'll do it. But younger people are saying, nah, that doesn't work anymore. And so we need a new model of team care that includes the patient as part of the team.
That's great. Thank you very much. One complaint that you hear from both doctors and patients is that there isn't enough time in a typical doctor's visit to discuss everything going on in their lives. What recommendation do you have for fellow physicians and how they might deal with that question or that issue?
Yeah, this is a major problem, actually, and it's one that I hear all the time, and I struggle with myself in my own practice, having enough time to be able to address, what matters to the patient around their chronic conditions or the prevention of chronic conditions. Part of the problem is that we've structured the encounter and we've structured a fee-for-service, volume-based approach that rewards people for doing more things with less time. If you can check off your code in a visit, 10 times a day and get paid for all of those, when you really need to have one long conversation in those areas, then the driver, the economic driver, is that, well, let me have you come back. And that splits up and makes it more difficult to have these deeper conversations about what matters to a patient and the underlying determinants. So we need to restructure how we do primary care, especially for chronic diseases that allow for that time. Now, the reality is you're already spending that time. If you come back and you need to have, 3 or 4 visits around the same condition and you get something that doesn't get at the underlying causes, then you could continue on for many, many years. In fact, I work in a clinic where a lot of chronic pain patients are referred to me, and they have had many, many visits, and they've spent 20 minutes getting pills and procedures and discussion, but no one has actually sat down and said, well, how can we empower you to improve your own pain in your own life and set a team up that allows you to actually manage that yourself? And if we do that, then oftentimes we can break that cycle of a dependency on continued medical care that occurs in the 20-minute visit and get them on the journey to healing.
Thank you very much. How do primary care physicians introduce things such as meditation, yoga therapy, massage therapy into their treatment for their patients? What's the best way for them to start to incorporate those into their existing practice?
So I find in working with patients, and I work with a lot of patients that come in and are not necessarily, advocates of integrative practices or anything like that. They just come in a normal primary care visit. And so what I do is I start and say, introduce them to the fact that a lot of non-pharmacological approaches to treatment are available and that there's evidence for those, and that my job is actually to make sure that they're using evidence-based practices and not going off into sort of tangents that don't work or might even be harmful. So my goal as part of their team care is to actually be the one that provides the scientific evidence and have that dialogue with them. A lot of times I'll describe what goes on biologically when they engage in those kinds of activities, such as with yoga and acupuncture. We actually know a lot about the mechanisms of those, how it changes your brain, how it changes your perception of pain, how it enhances your ability to engage in behaviors that facilitate your health. And so that description helps patients a lot of times to understand the medical why. And then if we can link that up to kind of what they want to do and why they want to do it, then that creates the motivators. I remember I had a man who had come in and had multiple treatments for chronic back pain, almost over 20 years, lots of different treatments, including surgery. And I asked him, you know, well, if he was relieved of his back pain, what would he do? What was the most important thing for him in his life? And he immediately knew what it was. He said, I would jump in my car, I would drive 5 hours down to see my grandkids, and I'd get down on the floor to play with them. He wasn't able to do any of that. And I said, oh, so you want to play with your grandkids, right? He said, yes. I said, great. Here's your goal. Let's see if we can figure out how to do that. So I took him over to the physical therapist, and we worked with the physical therapist simply to get him up and down off the floor. Now, that hurt, okay? He had been going to see people for treating his back pain and doing all kinds of things, and now he was doing something that actually temporarily made it worse. But he was doing it because he knew it would get him to a goal that was important for him. And after about 3 to 4 months, he was able to do that, and he called me up after having jumped in his car, gone down, and gotten on the floor and played with his grandkids. And now he was on his way to healing. And he never looked back. In about 4 or 5 months, he found that his pain was actually significantly better because he was engaged in a non-pharmacological approach or a non-drug approach for the treatment of his own pain.
That's great. Thank you very much, Dr. Jonas. Let me ask one sort of big picture question. What do these findings that you present today tell us about our healthcare system as a whole and in general?
Yeah, I think our healthcare system has been caught in this cycle of volume where we wait until predictable chronic disease manifestations end up becoming acute. Then we jump in with highly expensive approaches. Those things multiply themselves. And we end up spending a lot of money in things that we could have both prevented and possibly even reversed in those areas. So we need to restructure our healthcare delivery system and pay for value. We need to pay for good outcomes, for satisfaction, and for lower costs. And if we do that, I think we will find that there's actually a lot of resources in the healthcare system already for improving the health of the population that we're not going to be short of money. In fact, we'll probably save money in the long run if we restructure our healthcare system to do that. That's called going from volume to value.
Wonderful. Thank you very much, Dr. Jonas. Our next question from the group, how do we mainstream the mindfulness modality into treatment protocols for chronic pain and opioid addiction?
That's, I think, a great question and a very important one for our times. As I'm sure my listeners know, probably every state and a couple presidents and all the senators, all our national policy debates recently have been focused around the opioid epidemic. National guidelines have looked at this carefully that have come out from the NIH, the CDC, the American College of Physicians, and others, and they've said we need to manage pain differently, not simply with opioids. We should reduce opioid prescriptions, but what I find in my own practice, and I find with primary care providers, which is where most of pain is actually treated, I wasn't given the skills to actually implement those non-pharmacological approaches. So I think the most important thing is that in all these debates, we need to elevate the pain management efforts to make sure we're focused less on the drug treatment and more on the integration of medication and non-medication treatments in an integrative fashion. We need an integrative approach to chronic pain and opioid management, a whole person approach, in fact, dealing with many of the things that we saw in this survey. For example, depression, anxiety, all are often comorbid. That means they go along with and accompany chronic pain. And so simply treating the pain without treating the emotional, the social, and indeed even the spiritual components, the mental and spiritual components, is not going to get at what is sometimes called the diseases of despair that things like opioid, drug abuse, and even suicide fall into.
Thank you. Thank you very much, Dr. Jonas, for that, that great presentation on the survey results and for providing excellent context on why these findings are so important for both patients and physicians. Also, on the phone, thank you all for joining today's presentation. We hope that you found it insightful. If you have any further questions, please reach out to Kathleen Petty at kpetty@thereesgroup.com. To find more information for physicians on how to incorporate more conversations around whole person healing into your own practice, or for patient resources on these topics, you can visit drwanyejonas.com. This concludes today's presentation. Thank you all very much.